My name is Rylee White, and I am a second-year medical student at the University of South Carolina School of Medicine in Columbia. I was able to work this summer with Drs. Kumar, DiPette, and Dr. Coauthors. And we looked at the cardioprotective effect of alpha-calcitonin gene-related peptide, encapsulated alginate microcapsules in a pressure-induced mouse model of heart failure. So alpha-CGRP is an endogenous peptide, and it is known to be a very potent vasodilator. It's been seen to have a number of protective effects against many cardiovascular diseases. So you're probably wondering why it isn't being utilized in current pharmacological for treatments for like heart failure and things like that. And that's because it has a very short half-life. So it can't really be utilized in long-term treatment for patients. So what our group did was to look and find a drug delivery method where we could utilize this endogenous peptide. So what we decided to utilize was the Alginate biopolymer, and we utilized an electrospray method, which you can see in figure 1A. So essentially, we used this electrospray method to make alpha-CGRP into like mini microcapsules, and we could use this to administer it to mice subcutaneously. So we did an experiment to test the efficacy of this drug delivery method. And in that, we had 4 groups of mice. We had our sham that were treated with alginate. We had our TAC, and essentially what TAC is where you go off and tie the aorta, and it induces pressure overload in the mice, and it has very similar effects of heart failure. And then we also had the TAC and then treated them with alginate. So we had 4 groups. So our first experiment, we would do the TAC procedure or the sham, and then we would inject with alpha-CGRP microcapsules every other day. So we would alternate. And what we found at the end of a 28-day period is that the pathology that was induced by the TAC model was attenuated when treated with alpha-CGRP. So in figure 2A and B, we utilized ultrasound methods to get these measurements, and we found that the fraction shortening and ejection fraction was significantly reduced when mice underwent the TAC procedure, but when they were treated with alpha-CGR microcapsules, this reduction was attenuated and their functioning was continued. We also found the same to be true whenever we underwent histological examination of the mice heart. So figure 2A, C, D, and E. So utilizing different staining methods, we found that the hypertrophy of the myocytes as well as the fibrosis of the myocytes was decreased when they were treated with alginate as compared to the TAC alone. So going off of this first study that we found, we then looked to see if we could potentially do lower dosage or less administration. So we did a lower dose for one experiment, and then we did weekly administration as opposed to every other day administration to see if this would prove to be basically easier for patients in the future to have to take this medication less as opposed to every other day. But we found that this is what you can see in figure 3A and B, that this same change was not noted in the lower dosage and the larger time frame. So the attenuation of the pathophysiology was not seen in decreasing this. So in conclusion, we found that this drug delivery method was efficient in mice models that had heart failure to reduce the pathophysiology. However, whenever decreasing the dosage or increasing the time between dosages, it did not change this.
Questions? Okay, we got one back here.
So the microcapsule delivery, thank you for the presentation. the microcapsule delivery, is it every few minutes it's releasing your product, or is it over the course of 24 hours? Or since the half-life's only 5 minutes, what is the delivery method?
Are you asking specifically how we make the microcapsule?
Just like how it's working in the mice, like is it releasing this alpha-calcitonin gene or the encapsulated every few seconds, or is it just like over time?
So we actually, I didn't have enough room because I only have 5 minutes in one poster.
Yeah.
But we have a specific graph that shows like the different dosages and how it affects them. So the dosage that we used was the 6 micrograms per kilogram, but we had like a graph where we found different dosages and it was a gradual release. And there, I think the largest dosage we did maybe 18, and it worked for so long and so well that the dosage actually went below what our like machines could read as far as blood pressure goes, and then it came back up like over a week later. So this 6 micrograms per kilogram is like slowly comes down. I think it comes back up around like day 4 or so. So it's an extended release over multiple days.
Okay.
Thank you very much.
Thank you.